Hi, what's up, guys? My hip stuff today. Okay, hey, if you noticed, last week was abduction, all right, and adduction, things that help that. We also focus on the hip flexion and extension, and then sometimes we'll focus on the rotation, internal and external rotation. Okay, and that's what we're focused on today. We're gonna start off with the anterior, okay, hip smash and adductor. Okay, we're just gonna tackle that whole medial side, all right, that sometimes gets impinged, locked down a little bit. All right, nothing fancy here. We do want to go through that range of motion with the knee out, a straight leg, knee out. All right, I'll touch up on it just in case for a couple seconds. Goes right in that nook of that hip. All right, I'll start on the anterior hip side, kind of go left and right to scrub across the tissue, and I'll take this knee, I'll drive it out, knee up, okay, maybe scrub the tissue within the inner thigh there, and then go back to that straight leg, okay? Let's go about 90 seconds. I'm hoping we have 2 minutes. If you have 2 minutes, get it, okay? 2 minutes on each side. Now, if not, take a little time off, right? Because it is going to be a little bit longer, maybe more like 9 minutes today in mobility. When you get done there, we're not going anywhere, we don't have to band anything. We're going to go with the internal rotation stretch, right? The only thing that's going to be different today with these two stretches, we're going to do one leg first and then flop over to the other side, okay? Now, remember, in this internal rotation stretch, okay, a few tips. Heels to butt here. Right, I'm going to kick this leg out. All right, now I'm gonna watch my ankle. I really want it in line with my knee, and then I'm gonna lay this over the top. Okay, if my heel's close to my butt, I'm not gonna feel it like I need to. Ankle, okay, in line with that knee, right, and then throw that leg over the top. Some guys may be okay with just dropping this knee down. Right? Throw that leg over the top though. We don't want the butt to come up off the ground, to belly up here. We'll dodge the whole stretch. So keep your hip down, right, as much as you can, and then pull that knee there. If they feel pain in the knee, we need to make a little adjustment here. That means they're torquing at that knee versus the hip, okay? When you get done with 45 seconds to a minute there, we're gonna kind of flop around and go into an externally rotated position, which is the pigeon, all right? Nothing fancy here. Do your best to keep that leg flat today, and then we'll get up over the top and stretch out here for 45 seconds to a minute, all right? Then go into, all right, your left leg, right, kicking that thing out, making sure it's in line, right, and then throwing that leg up over the top, right, keeping that hip down. 45 there. We'll swap up here and then go ahead and knock out that side there. All right. Once we get done with those 3 to 4 minutes with the stretching, we're gonna go over to the rig, wall, door frame, whatever you can grab. We're gonna shoot for 2 minutes of a squat hold. We may increase the time over the next few weeks. All right, but find a place to squat. Now, everything that we practice in the squat is what we need to focus on here. Do not let them slouch, get lazy here, because whatever position you stretch in or practice in is really where your body's gonna wanna go, okay? So, have them walk to the pole, drop into your air squat, all right? Hold on to that pole so that it'll give you a little counterbalance. Drive your knees out, heels are down, and I'm gonna try and keep my scaps together with my chest up, right? And I can wiggle around here. I can go left, I can go right, lift my heels off as I drive my knees out, okay? What we don't want is we don't want these guys getting down into this position right here, right? We don't squat with our back like this, so we shouldn't stretch or move in this position. So stay here, right? Drop into as deep as we possibly can with the knees out. Use that pole for help, all right, to maintain that whole 2 minutes, okay? That's it for HIP this week. I'll see you guys later today. Have a good day.